will start shortly.
Order, order. We start with questions to the Secretary of State for Health and Social Care, Dr. Helen Whitehead.
Thank you, Mr. Speaker. Question number 1.
Secretary of State.
Mr. Speaker, the Government's 2021 fuel poverty strategy recognised that warm homes can help reduce health inequalities and pressure on the NHS. That is a key reason why we are delivering a package of cost support worth £3,700 per household on average from 2022 to 25 and investing heavily in fuel efficiency.
Helen Whitehead.
The recent Marmot Institute for Health Equity report highlighted, indeed, the negative effects of living in cold and uninsulated homes, including respiratory and circulatory diseases, and hampered children's lung and brain development. Now, last year, the Energy Systems Catapult and a number of NHS providers ran a trial of warm homes prescriptions, with NHS practitioners identifying and supporting vulnerable patients with their energy needs. Does the Minister, indeed, as the Minister I think has, the Secretary of State has accepted the link between cold homes and health outcomes? And if so, is the Government considering expanding this approach or looking for alternative ways that the health system and fuel poverty prevention can go hand in hand?
Well, may I thank the honourable gentleman, and he's right that a number of local warm homes prescription schemes have offered additional support to help people with health vulnerabilities stay warm and well. Such schemes are, we think, excellent examples of local collaboration between the NHS, local government and other partners, tailored, of course, to the local needs of their areas. And I would be very interested to see if other parts of the NHS choose to take up these sorts of ideas in the future as well.
Mary Robinson.
Thank you, Mr. Speaker. It's welcome news that the brand new £30 million A&E... Question 2. Thank you, Mr. Speaker. With your permission, I will take questions 2, 9 and 14 together. A year ago, we set out a plan to improve urgent and emergency care, and the plan is working. Performance this winter has been better, with ambulance waits down by nearly a third. And we're learning the lessons from this year to make further improvements in the year ahead.
Mary Robinson.
Thank you again, Mr. Speaker. It's welcome news that the brand new £30 million A&E campus at Stepping Hill Hospital is nearing completion. However, other buildings on this ageing site are failing and urgently need replacing. Will my honourable friend ensure that Stepping Hill remains at the heart of hospital facilities in Stockport with rebuilt units and support new hospital investment and specialist diagnostic hubs across Stockport? Well, I'm delighted that Stepping Hill Hospital will soon have a new emergency care campus with all the benefits that will bring to her constituents. I know my honourable friend is a great campaigner for her local NHS and has already met the Secretary of State about the concern she raises. As well as making her argument so clearly in Westminster, I would encourage her to continue discussions with her local NHS Integrated Care Board, who are responsible for local decisions on capital investment.
Leitrim.
Mr. Speaker, and up to 900 million brand new acute hospitals coming to Mid-Hampshire, and health experts are making the case that this makes huge improvements in care despite some politically inspired and misinformed opposition. Can my right honourable friend reassure my constituents that those running our local NHS should be listened to, and also reassure them that the doctor-led urgent treatment centre in Winchester will continue to provide for 3/4 of urgent cases, including X-rays, MRI scans and other tests, after the new acute hospital is built, which we hope will be at Junction 7.
Well, can I commend my honourable friend for her hard work to support the new hospital and for the leadership she's providing and her work encouraging residents to have their say in the consultation. I can't prejudge the outcome of the consultation, but I can agree with her. The new hospital will be great for patients with modern facilities, and she's right, an urgent treatment centre provide excellent emergency care for the majority of people who attend A&E.
Andrew Lewer.
Thank you, Mr. Speaker. Northampton's been the beneficiary of much welcome new or improved facilities in recent years, Children's A&E, a main A&E and the announcement of a community diagnostics centre. However, the missing piece of the jigsaw is an urgent treatment centre, and I've been campaigning for this for many years now. Can the Minister inform me of the progress of this centre?
Well, can I congratulate my honourable friend for his successful campaigning for healthcare in Northampton, which, as he says, is benefiting from upgrades to the Children's A&E and the main emergency department, and will soon have one of our 160 new clinical diagnostic centres. My honourable friend will know that his local NHS Integrated Care Board will decide whether to fund a new urgent treatment centre, and I have every confidence in his ability to persuade them.
Christopher Bryant.
Thank you, Mr. Speaker. One of the great successes over the last few years has been that we save a lot more people's lives who've had an acquired brain injury. But one of the problems is that we may save them in acute and emergency care, but then making sure that they have the proper care thereafter is a really important part of having a national strategy for acquired brain injury, which the government appointed me and the Minister, who's just passing her a note to inspire her on the subject, to try and publish. When does she hope that there will be some money to make sure that that strategy is a strategy worth having?
Well, I know that the honourable gentleman is a great campaigner and has worked very hard on this with me formerly and also now with my colleague, the Minister. I can assure him we are in the process of revising the draft strategy, taking on board the feedback we've heard from patients, their families, charities and the NHS. We will be publishing the strategy in due course. I'd like to thank all stakeholders for their continued efforts in this work.
Helen Walker.
Mr. Speaker, the average Category 2 response time for West Midlands Ambulance Service was over 43 minutes in January. We know that the problems are worse in Shropshire, and that follows on from stories like a lady who waited for 18 hours before seeing a doctor, having contracted an infection following radiation therapy for her cancer treatment. The situation in Shropshire doesn't seem to be improving as fast as we'd like it to. Can she give me an assessment of the steps that she's taking to resolve that problem?
Across the country, ambulance response times have come down by a third. We've worked very hard, particularly with areas that face greater challenges, including Shropshire, as she refers to, and I have spoken to leaders in the local health system about the ongoing challenges. One of the things we're doing now is learning lessons of what has worked over the last year and where we haven't made so much progress to make sure that we do better in areas like hers over the year ahead.
Jim Shannon.
I thank the Minister very much for positive answers. I really appreciate it. Bearing in mind the pressure that GPs are under, which is leading to more pressure on emergency provision, what steps have been taken to provide greater incentives for medical students to take on positions in GP surgeries? If they did that, it'd make a big difference. Thank you.
The honourable gentleman is absolutely right to talk about the whole health system, and one of the things we're doing as part of our work on urgent and emergency care is indeed to prevent people who are admitted unnecessarily to hospital or prevent them being brought to A&E in the first place. Primary care is part of this. One thing I can assure him that in our investment in expanding medical school places, we're particularly encouraging medical schools like the new one near me in Kent and Canterbury to train students to work more outside hospitals, including in primary care.
Minister Karen Smith.
Thank you, Mr. Speaker. Now, despite the government watering down the targets for both ambulance response times and the A&E 4-hour waits, they still can't meet them. And we've heard, in fact, across the House this morning, from all sides of this House, how much patients are waiting longer. Yep. The new targets say that there will be further improvements in 2024-25. The Minister has said that again this morning. So can she let us in on what exactly they will be?
I'm not going to preempt the publication of targets for the coming year, but as I've said, we will continue to learn lessons from the progress that we have made over this year, including ambulance response times down by over a third. And anyway, I'll take no lessons from Labour because we know the state of the NHS in Wales.
Thank you very much, Mr. Speaker. Number 3.
We are making great progress on our 10-year vision for adult social care reform. We've introduced the first ever national career structure for care workers, and we've introduced new assessments by the Care Quality Commission, which will shine a light on how well councils are delivering their social care duties.
Thank you, Mr. Speaker. I'm most grateful to my honourable friend for that reply. In Suffolk, where there is an increasingly elderly population, Social care is under enormous pressure, and it is a significant challenge to recruit carers, to pay them fairly, and then to provide them with a proper career path. Therefore, I hear what my honourable friend said, but will she consider commissioning a long-term workforce plan for adult social care equivalent to that for the NHS?
Well, my honourable friend is right about the importance of the social care workforce. Social care is its workforce. I can assure him we already have a plan for the care workforce set out in the People at the Heart of Care white paper, and now we're putting that plan into practice. Our care workforce pathway is already being implemented. Our new accredited qualification for care workers will be launched later this year, and we're backing social care with up to £8.6 billion in extra funding available.
Thank you, Mr. Speaker. I was concerned to hear that a constituent of mine was initially denied access to social care for his mother, who suffers from Alzheimer's, despite the fact of her inability to administer her own medication. Will the government look into broadening the criteria of the Care Act to include those requiring support with administering their medication?
Well, we very much want to see that everybody who needs care should get it. Everyone who's eligible for financial support should get it. That, of course, is assessed by local authorities. One thing we're doing is introducing CQC assurance of the social care by local authorities to make sure that people get the care they deserve and shine a light on where local authorities are doing a really good job, where others could do better.
Tom Hunt.
The idea of a social care cost cap has sort of dropped off the agenda slightly. I know it's incredibly expensive, but I continue to be contacted by constituents who face losing everything. At a time where often their loved ones have got dementia, it's already emotionally incredibly traumatic time. They have this added anxiety about how they're going to pay for care. The only thing which should matter is what works and what is best for their loved one. And we fight this cloud of anxiety that hangs over society, which we all worry about. Could the Minister confirm that this has not lost her attention, and that we will continue to consider whether we can do it?
Well, I thank my honourable friend for the question. It's a very important point he makes about the concerns people feel about the cost of care and how much that costs some people. As he may know, I may remind him that the charging reforms were delayed after we listened to local authorities by the Chancellor in 2022.
Tim Parham.
A fifth of the social care roles within West London Furnace are currently vacant and unfilled. Coincidentally, that's the same proportion of beds in Morecambe Bay that are occupied by patients who are not able to get a care package and therefore leave. The reasons for this are blindingly obvious, which is that pay and career structures are derisory for hard-working, wonderful people, and there's a complete absence of anywhere affordable, genuinely affordable, for people in those sorts of roles to be able to afford to live locally. Would the Minister agree that fixing that crisis in my community and others should be the priority of the Chancellor tomorrow, not silly electoral gimmicks?
Well, I will say to the honourable gentleman, I recognise the challenges in his area, although nationally vacancies in social care have fallen by over 20,000. We are reforming adult social care careers to make care a career for the UK workforce. We're putting extra funding into social care, up to £8.6 billion over 2 years, introducing CQC assurance to make sure local authorities are doing their best on social care. I would encourage him to talk to his local authority and make sure that they are paying a fair rate for the care they commission.
Peter Graham.
Question 4, please.
Sorry. I'm back. With your permission, Mr. Speaker, I will take questions 4, 10 and 19 together. Care is a skilled profession, and I want care workers to get the support and recognition they deserve. In January, we took the next step in our ambitious care workforce reforms, launching the first ever national career structure for the care workforce, alongside our new nationally recognised care qualification.
Peter Graham.
I know the Minister will want to join me in thanking every single person who dedicates himself to working in our social care sector, including and perhaps particularly those who have come to the UK from overseas in order to do that. But it's not sustainable to rely on incoming workers forever. The Migration Advisory Committee has found that Scotland is now less reliant on migrant workers in its social care sector than England by the simple expedient of paying them a decent wage. That's, by the way, a good way also to stop your doctors going on strike. The Minister might want to look at. Has the Minister asked the Chancellor to provide funding in the budget so that social care workers in England can enjoy the same pay and conditions as their colleagues in Scotland? And if not, why not?
Yeah. Well, I can agree with the Honourable Gentleman that we are grateful to all those who work in social care, including those who have come here from other countries to care for our loved ones. But we also don't agree that international migration is a long-term answer to our care workforce needs. That's why we're reforming social care to work as a career, and we're backing that with extra funding, up to £8.6 billion extra for social care over 2 years.
Sarah Owen.
Thank you, Mr. Speaker. I'm afraid the Minister's warm words around social care workforce isn't meeting the reality check for most people. The government's own statistics show that there are at least 152,000 vacancies in England alone in social care, leaving my constituents waiting up to 10 weeks to be discharged from hospital. The government have been using international recruitment to plug the gaps. As a result, they've filled over 11,000 vacancies over the last few years. So can the Minister confirm if the recruitment and contention in social care will be better or worse due to the government plans to prevent overseas social care workers bringing family members to the UK?
As I said a moment ago, vacancies have fallen and the care workforce grew by over 20,000 last year. We're seeing better retention as well as care workers, but we need to go further. That is why we're reforming social care careers, introducing the first ever national career structure for the care workforce and new qualifications and training.
Edinburgh Trade Union Congress recently described changes to the healthcare worker visa route as cruel and inhumane, and many of my Edinburgh South West constituents who have relatives in care share their concerns, as do I. We know the valuable contribution that foreign care workers make to the sector. Now, ideologically driven change to visas could further exacerbate the recruitment and retention crisis which other honourable members have so eloquently described. So, given that the government skipped consultation on these changes, will the Minister commit to meet trade unions and social care leaders in Scotland to understand the impact of these harmful changes?
Well, I am grateful to international care workers who have come to the UK to look after our loved ones, and their work has contributed to reducing vacancies and increasing the supply of social care. But we need to get the balance right between international recruitment and our homegrown workforce. We are carrying out ambitious reforms for our adult social care workforce, and therefore it's right alongside that to make sure that we have the right numbers of people coming here from overseas for social care, and that is why we've worked with the Home Office on changes to the visas.
Managers of the wonderful care home I visited in Dunstable on Friday were annoyed at the number of job applicants for care places who were making interviews and then not coming on the day. So I wonder if she could just have a word with ministerial colleagues at the Department of Work and Pensions to make sure that job coaches are certain that job seekers are not wasting the time of care homes, because it's not fair. They're busy people with a lot to do.
Well, I thank my honourable friend for the question. I do work closely with colleagues in the Department for Work and Pensions on the recruitment of people who are looking for jobs into social care, and I will indeed raise that point with my colleague in the department.
Shadow Minister Andrew Gwynn.
Thank you. But look, it was her party that promised to fix the crisis in social care for once and for all. With vacancy rates almost 3 times above the national average and turnover rates for new staff at over 45%, it's clear that they failed. Labour's plan for a national care service with clear standards for providers and a new deal for staff will give social care the fundamental reset it needs. They've done it with our workforce plan, they've half-heartedly tried it with dentistry. Does the Minister want to copy our homework once again?
Let's be honest, Labour has no plan for social care. Whatever he says, it's unfunded. There's no funding committed to it. It's not meaningful. On this side of the House, we are reforming adult social care. We not only have a plan, but it is in progress.
SNP spokesperson Amy Callaghan.
Thank you, Mr Speaker. I've asked the Secretary of State a number of times how she intends to recruit and retain social care staff, particularly with visa changes coming into effect next Monday, stopping those from overseas coming to fill skills gaps from bringing their spouse or dependents with them. So I ask again, how does the Secretary of State intend to improve recruitment and retention of staff in the social care sector, whilst her colleagues effectively work to undermine her?
Hear, hear.
We're grateful to international workers coming to support us in social care and improving supply, but we have to get the balance right between international recruitment and our domestic workforce. In England, we are reforming social care careers to make social care work as a career for our homegrown workforce, and I would encourage her to make sure they do the same in Scotland.
Tulips today.
Thank you. Question 5, please.
Thank you, Mr Speaker. Improving maternity care is a Year 2 priority on our Women's Health Strategy for this year. So any decisions around maternity services need to be focusing on improving outcomes for mums and babies. However, for local reconfiguration of services, these decisions are made by local integrated care boards and local trusts.
Tulips today.
Thank you, Mr Speaker. The maternity unit in the Royal Free Hospital in my constituency is facing closure. Last week, I met with doctors from the maternity unit who told me that the Royal Free is uniquely placed to help mothers with diabetes, to help pregnant women who have HIV, and to help mothers who require interventional radiology. Exactly. The Royal Free is the only local provider that offers this life-changing treatment 24 hours a day, 7 days a week. Yep. So could I ask the Minister, does she agree with me that the maternity unit of the Royal Free Hospital has to stay open for the sake of these vulnerable groups of women?
Well, I thank the Honourable Lady for raising her concerns, but as I said, this is a public consultation, I understand, which is running for 14 weeks and will close on the 17th of March. So I would urge her to raise those concerns as part of that consultation. Absolutely, it's crucial that we keep expertise in our maternity services, but my understanding from the local proposals by the Trust and the ICB is it outlines plans for £40 million worth of significant additional investment into maternity services. But those decisions are for the local ICB and the local trust, and the deadline for response is the 17th of March. I'd urge her to make sure she takes part in that.
Sir Charles Walker.
Thank you, Mr Speaker. Mr Speaker, remaining in North London, can I bring to the Treasury bench my concern about the quality of nursing care in Barnet Hospital? An elderly constituent of mine in her 80s was admitted recently. She asked to use the lavatory and was told no one could take her and was handed a nappy. Oh. She waited 3 hours until someone could actually take her to the loo. She was a celiac, but was not offered any food for celiac during her 10-day stay because nobody had read her notes. And she was moved around her bed by her arms. She had a broken shoulder. Oh. Nobody knew that because nobody had read her notes. Oh.
Well, I'm very sorry to hear about the experience of his constituent, and that is absolutely not acceptable in terms of levels of care. I know he has raised this particular issue with the Patient Safety Commissioner, Henrietta Hughes, but I am very happy to meet with him and his constituent to discuss those complaints. That is not acceptable care.
Sarah Green.
Question number 6, Mr Speaker.
Thank you, Mr Speaker. At Buckinghamshire Healthcare NHS Trust, the number of gynaecology patients waiting over 52 weeks reduced by over 30% between August and December. But I sympathise with the many women who are still waiting too long. NHS England has been doing targeted work to help trusts with the most long waiters to support gynaecology patients in the community where appropriate and find specialist services that can treat them as quickly as possible.
Mr Speaker, my local NHS Trust recently stated the average wait for a gynaecology appointment is 18 weeks, with patients starting treatment within 24 weeks, but this doesn't include those on cancer pathways. One of my constituents, who had been identified as having abnormal cells in her cervix, waited more than 60 weeks for a diagnostic assessment. She's one of many contacting me with tales of long delays for gynaecology appointments and paying to go private out of desperation. Can I ask the Minister what steps his department is taking to reduce waiting times for gynaecology assessments and treatment for those on cancer pathways?
Thank you, Mr Speaker. Well, significant investment is going in to both reduce general wait times as well as reducing cancer wait times. More patients on the cancer pathway have been seen than ever before. Nearly 220,000 patients were seen last December following an urgent GP referral for suspected cancer, representing 117% of the December 2019 levels. We continue to keep this under review and continue to strive to make the system go faster and reduce the elective backlog.
Shadow Minister Benapondesari.
Thank you, Mr Speaker. NHS figures from December show that the number of women waiting for gynaecological treatment reached another record high of nearly 600,000. This number has tripled since 2012. A Labour government will cut NHS waiting lists in England by funding 2 million more appointments a year. So what can the Minister say to the women waiting urgently for treatment?
Hear, hear. I would say that we're sticking to our plan to back the NHS to cut waiting lists and make our NHS fairer, simpler and faster. When there is no strike action, that plan is working. We eliminated already the longest waiters, and in November we saw the biggest fall in waiting lists outside of the pandemic in over a decade, Mr Speaker. Alongside record investment in things like women's health hubs, we are prioritising women's health.
Number 7, Mr Speaker. Thank you, Mr Speaker. With permission, I'd like to group questions 7 and 8. We have met our manifesto commitment to deliver a record extra 50 million GP appointments annually. Our primary care recovery plan addresses increased GP access and expands community pharmacy services nationwide with Pharmacy First. And our NHS dentistry reform plan also allocates resources for 2.5 million appointments targeting rural and coastal communities.
Thank you, Mr Speaker. I thank the Secretary of State for her response. And, Mr Speaker, I'd also like to thank my right honourable friend, the member for Pendle, for visiting the CDC and Minor Injuries Unit at the Herts and Essex Hospital yesterday, and all the fantastic staff we met there. Mr Speaker, Frontier Estates committed to building a GP surgery as part of the wider Stortford Fields development. However, citing inflated build costs, they now question the viability of the plans, and despite months of negotiations and efforts to find a solution by the local NHS. Will my right honourable friend work with colleagues at Levelling Up Department, with whom I've already met on this issue, to ensure that Frontier really engage with this process and builds the surgery they promised my constituents?
Well, may I first of all congratulate my honourable friend on the enormous amount of work she has put in her constituency to secure that community diagnostic centre. We know that we've rolled some 160 or so of these centres out across England. We want to do more, and they're supplying some 6 million tests and scans for patients across England. In relation to the very important issues she raises, my officials and Levelling Up officials are already considering how primary care infrastructure can be better supported in the planning process to ease the pressure on primary care estates, particularly in areas of housing growth, and I know that she will continue to be as conscientious in her campaigning on this as she is in other matters.
Thank you, Mr Speaker. Rural communities need local, easily accessible primary care. Now, after Long Crendon surgery closed during the pandemic, patients in that village and surrounding villages have been displaced mainly to Brill and Tame for GP appointments, for the vulnerable, for those without private cars. In the absence of regular bus services, that can be at least an unaffordable £25 in taxes to see a GP. Now, I've raised many times before an innovative approach to building a new health centre in Long Crendon by the Parish Council. They have the land, they have the agreement by the ICB for the rent to put Unity Health in there. We just need the money to physically build it. So will my right honourable friend break down every barrier to help us get that health centre built in Long Crendon?
Well, may I thank my honourable friend, and again, I very much admire the effort and the determination he is showing to stand up for his constituents. He will know, sadly, I am constrained from commenting on individual cases, but what I do know is that the sort of innovation that he is showing alongside that of his parish council, and indeed I would hope his local integrated care board, is the sort of approach we want to adopt across our rural and coastal communities to ensure that they too too have the access to primary care we all expect.
Honourable Vars.
Thank you, Mr. Speaker. Equal access to primary care is so important, but the use of physician associates is downright dangerous. Does the Secretary of State agree that patients have the right to see a qualified GP and not be fobbed off with a two-tier primary care system?
Mr. Speaker, look, I understand the concerns we have seen in the media, but please, we in this House have a responsibility to our constituents and indeed to professionals working in healthcare, including our clinicians, including physician associates. In fact, physician associates have been working in the NHS for some 2 decades. They are there to work with doctors, to assist them, to free up doctors' times, to focus on the task that only they are qualified to do. We have been very, very careful to listen to concerns that have been raised, which is why we have announced recently intentions to regulate them. But we must all please take that responsibility for ensuring that we are not spreading concern where actually these roles can have a very, very positive effect on our healthcare system.
Thank you, Mr. Speaker. My constituents are fed up of battling to see a GP, so I've been trying to work really hard across party lines with local councils and the ICB. But I was surprised to hear from the Prime Minister in response to a question last week that with only £2 million allocated to my ICB for primary care, they should raid their hospital refurbishment budget instead. Could the Minister advise which part of much-needed hospital investment should be overlooked to compensate for a failure to invest in primary care locally?
Again, to, I hope, help inform the Honourable Gentleman, it is for integrated care boards to assess the needs locally of their area. We are very, very keen that if, for example, there is a concern about access to primary care, we give them the autonomy to make decisions about how they spend that. Of course, there are a couple of respects in which we have set expectations of integrated care boards. In particular, we expect them to use the money we have provided to provide dental care, and in addition we have set very clear expectations of integrated care boards that they will introduce at least one women's health hub in their area this year.
So the Select Committee, Steve Brown.
While we're talking recovery to primary care and given the Secretary of State's at the box, the Recovering Access Plan released last May talked about high-quality online consultation, text messaging services, online booking tools. That was due in July, then it became August, then it became December, and I understand now it's been delayed indefinitely due to a claim made against NHS England against what is a £300 million project. That is hitting access to primary care. I wonder if the Secretary of State could update the House.
May I thank my honourable friend. I mean, we are determined to bring not just primary care, but the whole of the NHS up to speed with technology. We are very, very firm advocates for the idea that technology can help free clinicians' time and help ensure that rather than spending time looking at computer screens, they are looking at their patients. In relation to primary care, of course, we are working to ensure that the digital telephony services that have played such a critical role in providing more of those 50 million additional appointments that I've already described. This plays a vital role, but of course I will take away his points and look carefully into them.
Desiree Cooper.
I've been corresponding with the Minister for Primary Care and her predecessors about urgently needing to protect general practice locations in city centres against outdated Treasury rules that are forcing them to potentially move to ring road locations. The Minister's latest reply to me suggests that the ICB can use capital funding to pay for new premises, but my ICB claims that that is against the rules. So would she and her officials please urgently meet with me and my local ICB so we can bottom out what the rules are and urgently protect our city centre GP locations?
Well, I thank her for her question, and I'll ask the relevant Minister to write to her.
Shall the Secretary of State West Street?
Thank you, Mr. Speaker. Look, the simple fact is that the Conservatives have been in power for 14 years now, and general practice has never been in a worse state. And despite slogging their guts out, GPs are struggling because this government have cut 2,000 GPs since 2015, making it even harder for patients to get a doctor's appointment. So given that, why has her government decided that what the NHS needs now is what the IFS have described as the biggest funding cut since the 1970s?
I know it's been a very, very long time since Labour were in government, but even he knows that government ministers will never comment on fiscal events the day before that said fiscal event. But let me introduce some facts into his his analysis. In fact, we have now delivered on our manifesto commitment for 50 million more general practice appointments per year, with 363.8 million booked across the last 12 months. That is compared to 312 million delivered in the 12 months to December 2019. If he stops shouting, perhaps he'll be able to hear something. And indeed, after about 62,000 more appointments were delivered per working day in December last year, excluding COVID vaccinations. The truth is that we have got our recovery plan for primary care. It is working. Of course, there is more to do, but even the honourable gentleman wouldn't be so churlish as to deny those extra 50 million appointments, surely.
There are fewer GPs.
Please. Thank you, Mr. Speaker. The honourable member will know that, shockingly, smoking kills 80,000 people every year across the UK and costs society £17 billion in ill health and loss of productivity. The government will introduce the Tobacco and Vapes Bill shortly, and I'm delighted to say that Northern Ireland have just this morning announced that we will be legislating for the whole of the United Kingdom. Thank you for the answer, and in doing so, we just want to say that the age-related bill of sale of tobacco products will create the first generation of smoke-free people in the United Kingdom. In doing so, I want to just maybe, all politics is local. It's vitally important that we have the same legislation in Northern Ireland. But the difficulty that I have in Northern Ireland, smoking contributes to 1,300 smoking-related cancers at least per year, and in my own constituency with 13.9% of the people who continue to smoke irrespective of the guidance given. I want to make sure, and I'm glad to hear the assurance from the Minister in relation to the age, the legislation and the bill for Northern Ireland, and I'm glad that that is the case. I just want to ensure that they engage with the Northern Ireland Executive to ensure that it is on their priority list. Yeah. Well, I can tell the honourable gentleman that the Secretary of State met with the Northern Ireland Health Minister just yesterday, and I absolutely assure him that all parts of the United Kingdom will be included in this once-in-a-generation public health intervention that will save millions of lives.
Bob Blackman.
Thank you, Mr. Speaker. Can I urge my honourable friend to get on with introducing this bill, because every single day that we delay, more people die of cancer and other smoking-related diseases. Equally, by creating this first generation of people that will not be allowed to buy cigarettes or tobacco products, that's excellent. But would she agree with me that one of the concerns is that young people now are taking up vaping instead of smoking, and vaping is clearly a path towards nicotine addiction?
Yes, my honourable friend raises an incredibly important point. There's no doubt that tobacco and vaping companies are now trying to recruit children, putting vapes, including many illegal vapes, next to the sweet counter with extraordinary flavours like bubblegum and berry blast and things that are clearly not designed, as was originally proposed, for adult smokers to be able to quit smoking and move to vaping. So he's absolutely right, and we will be bringing forward this once-in-a-generation legislation shortly.
Neil Lambert.
Mr. Speaker.
We have delivered our manifesto commitment of 50,000 more nurses 6 months early, and there are now almost 361,000 nurses working across the NHS. As part of that, community nursing has grown by over 9% since 2019.
Neil Lambert.
Thank you, Mr. Speaker. There's a crisis brewing in community-facing nursing over the past decade, with district nurses' numbers down by 40% and health visitor numbers in England and Wales falling by almost a third. What guarantees will the Minister provide that this vital workforce will be supported when health budgets in all of the nations of the UK are under increasing strain and NHS funding faces a £2 billion black hole, and cuts to spending in England obviously have a consequential impact on budgets in Scotland?
Well, Mr. Speaker, record funding is going into NHS, and in addition to the 9% increase in community nursing we've seen since 2019, we're investing over £2.4 billion in education and training through the long-term workforce plan, which commits to increasing training places for district nurses by 41% by the end of the decade. Since 2010, we have delivered over 63,300 more nurses and midwives into our NHS.
Question 13, Mr. Speaker.
Thank you, Mr. Speaker. Can I put on record my thanks to the members of the Pre-Legislative Scrutiny Committee who scrutinised our draft mental health bill. We are looking at their recommendations and we will be responding to their committee report shortly.
Olivia Blake.
It is now over a year since the Joint Committee report on draft mental health bill was published. Despite repeated promises of reform, the government has failed to act. More than 50,000 people are held under the Mental Health Act. It is an outrage to them and campaigners that reform has been deprioritised. Will the Minister confirm when the government plans to bring a formal bill to Parliament and what conversation they have had with the Chancellor in the run-up to the budget to ensure those reforms are properly resourced?
Well, can I just, as I've already said, we have published our draft mental health bill. It has been through pre-legislative scrutiny and we are responding to their recommendations shortly. But it isn't just about legislative reform. If you look at the £143 million we put in to crisis supports, we're already seeing less use of the Mental Health Act because people are being seen earlier. Our crisis cafes, for example, and our crisis telephone services have seen a 15% reduction in the use of the Mental Health Act. And that shows it's not just legislation that's needed in terms of reform.
Dave Jackie Doyle, please.
Thank you, Mr. Speaker. Can I just say to my right honourable friend, it is now a number of years since we promised to reform the mental health legislation which actually reflects a time when people with severe mental health were viewed as problems to be managed, not as individuals. And personally, I believe we on these benches, as Conservatives, should be doing everything we can to empower people and respect their liberties. It simply isn't right that in the 21st century, people's health conditions are being managed by forced administration of drugs which bear no respect for their liberties. Please, can I just reiterate the urgency with which these measures should be brought forward, particularly since people with lived experience have relived trauma to give them their benefit of their experiences.
Well, I absolutely agree. That's why the government published its draft mental health bill in January last year. We went through pre-legislative scrutiny. I gave evidence myself to the committee. They are very detailed recommendations that we're working our way through, and we will be publishing our response shortly. But it is in addition to the significant reform that we're making to mental health services, particularly getting in at an earlier stage, and things like the crisis cafes. We have seen it having an impact. We're seeing 15% lower detentions under the Mental Health Act. We're seeing 8% lower admissions into hospitals and 12% lower admissions from our mental health crisis telephone centres, which are now available across England 24/7.
Question 15, Mr. Speaker.
Thank you, Mr. Speaker. Women's health is one of my top priorities, and as we approach International Women's Day this year, we have already improved access to contraception and UTI treatment through Pharmacy First. We have announced £50 million of research into maternity disparities and other health conditions affecting women, and set an expectation that each ICB area will have at least one women's health hub operating this year.
I'm grateful. For over a decade, I've been raising the issue of the appalling and agonising treatment experienced by many women who need a hysteroscopy in the NHS. Many women are being left unnecessary trauma and they are reluctant to engage further with doctors. It's simply life-threatening. But the medical establishment continues to resist change and the government shirks its leadership role. Earlier this year, the Secretary of State set out her priorities for the Women's Health Strategy. Access to pain-free hysteroscopy wasn't included. Why?
First of all, I'd like to actually thank the Honourable Lady for the work that she has done in this area, because I absolutely acknowledge the issues that women are facing with this highly invasive procedure, often at what is an extremely distressing time in their lives. In terms of hysteroscopies, we are waiting for the Royal College of Obstetrics and Gynaecologists to update its guidelines on best practice in this procedure. Following consultation last year, it is now under peer review and is due to be published soon. But I am clear, as the Honourable Lady knows, that the responsibility should not be on women in those very distressing circumstances to ask for pain relief. It must be for clinicians to assume that the woman wants it and to discuss that with her ahead of the procedure.
Bill Clark.
Mr. Speaker, well, I welcome the Government's recent refresh of the Women's Health Strategy and the addition of birth trauma into it. I'm currently chairing a national inquiry into birth trauma, and we're hearing from mothers across the UK about some of the severe mental health conditions that they're facing, including postpartum psychosis. And I'm very concerned to hear about the risk of suicide by new mothers. So can I ask my right honourable friend what actions the Government is taking to address this?
Well, again, may I thank and put on record my admiration for my honourable friends sharing her own experiences in order to improve healthcare for women across the country. She will know yesterday we had a very important announcement regarding suicide prevention, and indeed there are elements within that that address exactly the concerns that she rightly raises. But also, thanks to her hard work, of course, we have also announced that within 8 or so weeks of giving birth now, GPs will be asking mums whether they are okay following pregnancy, and we very much hope that that will open up the conversation with women who may be struggling or facing concerns after giving birth.
Alison Thewlis.
AMA Birth Companions have just been recognised as in the 2024 GSK Impact Awards. This charity is doing really important work to support vulnerable asylum seekers and refugees who would otherwise face giving birth alone. Will she meet with them to discuss their work and the research, given the disparities that continue for this group of women?
Here, here.
Well, that's a very interesting piece of work that she describes. I'm going to ask my ministerial colleague to meet the charity, as of course we want to support women, and indeed part of our work across the Women's Health Strategy is ensuring that maternity services are not just safe but also trusted by mums-to-be.
Sir Mike Lawless.
Thank you, Mr. Speaker. With regards to healthcare for women, a gynaecologist who claimed Hammersmith would be better if it were Jew-free has been ruled not racist, but merely comfortable with using discriminatory language, according to the Medical Practitioners Tribunal Service. He was merely suspended for 3 months and is due to start seeing patients again in a few weeks. I'm concerned this doctor may be a danger to Jewish patients, and I'm also concerned that this tribunal is defective and their decision is grossly unreasonable. Will she instruct government lawyers to begin judicial review proceedings against this tribunal?
Well, may I very sincerely thank my right honourable friend for raising this. As the Prime Minister set out on the steps of Downing Street last week, there are people whose ideology and dogma are in direct conflict with our shared values as a country. And just as we will not stand for that across the country, nor will I stand for that in our NHS. And so I've already written to NHS England and regulators setting out their responsibilities and our expectations of them. And I can assure my right honourable friend I will be looking into this with great urgency and great care.
Penrose.
Call number 1, Mr. Speaker.
Mr. Speaker, I am committed to making our NHS faster, simpler and fairer for all, but including families. That is why Government has recently introduced baby loss certificates. Nothing can diminish the pain of losing a baby, but we hope that this formal recognition of a life lost can help families live alongside their grief. And indeed, since we announced this launch some 2 weeks ago, more than 37,000 certificates have been requested by parents. And that same commitment to families is why we are rolling out Martha's Rule across England, giving patients and their families the automatic right to a rapid review of their case 24 hours a day, 7 days a week. Families and carers know when something isn't right or that their loved one's condition is deteriorating. Martha's Rule not only recognises this powerful instinct, it also allows anyone concerned to act on it and to make sure that the NHS listens. And with your permission, Mr. Speaker, for which I'm very grateful, I would just like to alert the House to a written ministerial statement and a detailed letter from NHS England that has been laid this morning. This addresses an historic issue where women who received radiotherapy above the waist to treat Hodgkin lymphoma and therefore were at higher risk of breast cancer were not given annual checks. The NHS wrote to the 1,487 women affected yesterday in order to inform them. We expect all women to be offered a scan within the next 3 months, and NHS England has established a helpline and briefed GPs and relevant charities. The vast majority of this group of women will have already been receiving screening on a 3-yearly basis, but of course NHS England wants to ensure they receive annual tests in line with the clinical guidance. I wanted to alert honourable members, Mr. Speaker, because the letters having been sent out yesterday, it is perfectly possible and indeed probable that honourable members will start to receive queries from their constituents. I will, of course, keep the House of Commons updated. I do emphasise, however, what I have given is a summary, and I would encourage everyone to look at the very detailed letter, please, from NHS England in order to reassure their constituents that we are scooping everybody up that we can to look after them at this very troubling time.
Ben Rose.
Mr. Speaker, like many people here, I was delighted by last month's NHS dentistry recovery plan. Can I ask the Secretary of State, how many new NHS dental appointments does she expect to be available in my constituency of Weston-super-Mare, and by when?
Well, may I thank my honourable friend for his support of our dentistry recovery plan. Indeed, he was one of many colleagues who campaigned so hard for it. I'm pleased to actually inform him that dental activity, as measured by courses of treatment, increased by 15% from the previous year in my honourable friend's local integrated care board area, and our plan will support further increases to dental access with some 2.5 million additional appointments across the country, of course including his constituency. I should inform the House that the first measure went live on Friday, namely new patient premiums, and we will have the results of that, we hope, very soon.
Shadow Secretary of State Westridge.
Thank you, Mr. Speaker. With a general election in the air, can I just firstly welcome what the Secretary of State said in relation to baby loss certificates and also Martha's Rule. There is genuine cross-party agreement on this, and I also thank her for advance notice of the important written ministerial statement she has laid today. However, turning to the general election in the air, and given the Secretary of State's principled, vocal and consistent opposition to funding the NHS by abolishing the non-dom tax status, on a scale of 1 to 10, 1 being utterly shameless and 10 being highly embarrassed, how red-faced will she be tomorrow when the Chancellor adopts Labour's policy?
Mr. Speaker, one of the joys of being at the dispatch box on this side of the House is not only do we, in fairness, have to deal with some very, very serious matters, as I've just set out, but we also get to have a knockabout with the Labour Party when it comes to their electioneering. In terms of the funding of the NHS, he will know the proud record of the Conservatives since 2010 in terms of funding our NHS, and I invite him to wait for tomorrow's budget to see what more this Conservative government is doing to support our constituents and our economy grow for a bright future.
Thank you, Mr. Speaker. But the Minister, the member for Lewis, said that that policy would be as much use as an ashtray on a motorbike. So as she speeds down the A23 back to Lewis to defend her constituency from the Liberal Democrats, how on earth is she going to feel with all those embers of the Conservatives' record of 14 years blowing in her face down the motorway? Mr. Speaker, isn't it clear now, having adopted Labour's workforce plan, having adopted Labour's dentistry recruitment plan, and now adopting Labour's NHS funding plan, that when it comes to a record to be proud of in government and answers for the future, only Labour can deliver an NHS that's fit for the future?
Well, the Leader of the Opposition, of course, is a former barrister, and barristers like to rely on evidence. So let me give some evidence of what Labour-run NHS in Wales looks like. People are almost twice as likely to be waiting for treatment in Labour-run Welsh NHS. 21.3% of people in Wales are waiting for hospital treatment after consultant referral, compared to 12.8% in England. Patients are waiting on average 5 weeks longer for NHS treatment under Labour in Wales than they do in England. And the number of patients in Wales escaping to seek treatment in England has increased by 40% in 2 years. But don't worry, folks. According to the Leader of the Opposition, this is the blueprint for England.
Can I just say and remind everyone, this is topical, so a lot of members need to get in, and it's about members that I've got to get in rather than the ping-pong on the dispatch box. Let's just move to Andrew Jones as a good example.
Thank you very much, Mr. Speaker. I'm talking to my local integrated care board about establishing the first centre of dental excellence in North Yorkshire, to be located in Harrogate and build upon the dental recovery plan. Does my right honourable friend agree that boosting capacity is critical for catching up from the pandemic, and that centres of dental excellence are a very good way to achieve this?
Well, I completely agree with my honourable friend that we need more capacity in our dental workforce, and I know he will be a big advocate for his constituency. We have set out in the first ever NHS long-term workforce plan that we will increase dentistry training places by 40% by 2031-2032, and our dental recovery plan sets out many different measures to improve capacity.
SNP spokesperson Amy Cavanaugh.
Mr. Speaker, later this month I will be 10 years cancer-free, having survived melanoma first as a teenager and again in my early 20s. Can the Secretary of State look me in the eye and guarantee me she is doing all she can to prevent others from getting the same diagnosis I did?
Well, again, may I thank the Honourable Lady for sharing her experiences, and of course we are. And I know that the Scottish Government, the SNP, shares our determination to ensure that cancer treatment continues to improve. We are, in fact, in England diagnosing earlier and treating more. We have seen cancer survival rates improve by almost 10 percentage points since 2005, but we also know that 4 in 10 cancers could be prevented, which is exactly why we are bringing forward the smoke-free generation work. But of course, as I say, if the Scottish Government would like our help in helping them with some of their waiting lists, we genuinely stand ready to help with them.
The General Practice Estates and Technology Transformation Fund supported projects in my constituency, was appreciated by my ICB. What evaluation has there been of it, and will it be continued?
I've met a number of times with my honourable friend, and I know he is determined to resolve some of these long-standing issues in his constituency. I have assured my honourable friend that integrated care boards have the freedom to increase capital for primary care in their region, as long as their plans remain within their overall capital allocation. And certainly I'll be very happy to meet with him again to talk about more measures that we can take to support his constituents.
Rachel Maskell.
Thank you, Mr. Speaker. I held my first dental summit since the publication of the government's dental recovery plan, and I have to say it was met with disappointment and frustration. And the reason for that not being enough funding, flexibility, or indeed the resolution to the contract. So will the Minister set out a timetable for when the dental contract will be resolved?
Well, I'm very surprised and disappointed to hear the Honourable Lady say that. 2.5 million more appointments through the new patient premium, and that started last Friday, and we will have information within a month to see which dentists have in fact taken up this very generous new patient premium to ensure many more people get access to dentistry. But not only that, we've got golden hellos to attract dentists to areas that are underserved, mobile dental vans, and really importantly, a new focus on Smile for Life, which is going to ensure that all babies and young children have that fabulous Smile for Life.
Nigel Mills.
Pharmacy First services proved very popular in Amber Valley, but some pharmacists report there's confusion that the ear infection dose only applies to under 18s, and patients are being referred to pharmacies when they shouldn't be. Could the Minister either perhaps extend the service to over 18s or ensure that NHS communications are clear that it is only for children?
Well, my honourable friend raises a very important point, and he'll be aware that a decision was taken that actually earwax removal services are better done in the community, and that ear syringing can cause problems. It is an area that is under review at the moment, and I'm very happy to write to my honourable friend with the specific point he makes about over 18s and also for children.
Neil Griffith.
Thank you very much, Mr. Speaker. Whilst absolutely agreeing we should redouble our efforts to recruit and retain more homegrown carers, such as the Welsh Government is doing by paying them all at least the real living wage, in the short term we have to rely on foreign workers. But from her earlier answers, it appears the Minister is happy to deprive them of the enjoyment of their own family life, whilst we expect them to give our relatives loving care. So would you think again and speak to Home Office colleagues about dropping this totally inhumane ban?
As the honourable member will have heard me say earlier, we are grateful to international care workers who come to care for our loved ones in this country. We need to get the balance right between international recruitment and our homegrown care workforce. On the question specifically on dependents, I will say to her that every care worker who comes here to work in the UK has a choice whether to come here or not.
Can I thank the Health Minister for visiting the new medical school in Chelmsford yesterday? It's the first time students have ever been able to train as doctors in Essex's history, and the results are phenomenal. It's living proof of the government's commitment to train the NHS staff of the future. Can I ask him what progress he's making to increase work placements for students so we can train even more doctors, nurses and important roles like physician associates?
Well, can I thank my right honourable friend for her question and her kind invite to visit her constituency and pay tribute to all the work that she's done to secure investment in Anglia Ruskin University. She is right to highlight the importance of delivering clinical placements as part of the long-term workforce plan. I can assure her that we are working closely with NHS England and partners in health and education to ensure this happens.
Helen Brown.
Mr Speaker, medicine shortages have doubled in the UK in the last 2 years. Now, there might be some global pressures, but two issues that particularly affect the UK is one, post-Brexit regulatory framework, and two, the fact that the pound is completely tanked, making it more expensive to buy medicines. So what's the government doing to undo this Brexit dividend?
Thank you, Mr Speaker. The honourable gentleman is like a broken record as usual. The Department has no evidence to suggest EU exit is leading to sustained medicine shortages. Shortages occur for a wide range of reasons and are affecting countries all over the world.
George Freeman.
Thank you, Mr Speaker. Rural Norfolk is experiencing a dental crisis, and a generation of children are in danger of going without dental care. I welcome the dental plan, but I noticed it won't be until 2024, 5 years before we get the more dentists. Last week, Norfolk ICB announced a 17 million underspend in its dentistry. Would the Minister agree to meet with me and them to work out how we get more money out now to help dentistry in Norfolk today?
Well, one of the many ways in which we have tackled the access to dental care is to ensure that those dentists that have contracts to conduct NHS work are in fact using them to the top of their licence. We are encouraging dentists to do this through the new patient premium, but also through a higher rate that we're paying for units of dental activity. There is so much more to this plan. I know that Labour keep trying to claim credit for our plan. The truth is our plan promised 2.5 million appointments. There's a miserly 700,000.
Hopkins.
Thank you, Mr Speaker. It's imperative we tackle the scourge of mental ill health in children and young people. Labour will ensure access to mental health support in every school and will establish an open access mental health hub in every community, paid for by charging VAT on private school fees. Why won't the government adopt this plan?
Well, there's a news flash for the lady. We're already doing all of that work. We've got mental health support teams being rolled out in schools. 44% of pupils have now got access to a mental health support team. That will be going up to 50% shortly. Over 13,800 schools and colleges now have a trained senior mental health lead in their schools. Only yesterday, Mr Speaker, we announced only last week, we announced 24 early support hubs for those aged 11 to 25. Don't need a referral, they can be dropped in. There's 24/7 helplines available now that will be accessed through 111. That's what we're doing.
The Mid and South Essex ICB are seeking to remove vital community health services from St Peter's Hospital in Morden. Would the Minister meet with myself and the Right Honourable Member for Morden to discuss these proposals, because it's going to affect both our constituencies and this is causing a great deal of concern?
I would be very happy to meet the Right Honourable Lady to discuss the concerns she raises.
Christine Jardine.
Thank you very much, Mr Speaker. Can I first of all thank the Secretary of State for her offer to help cut waiting lists in Scotland, because frankly I listened to the delusional statements from the SNP benches about the state of the NHS in Scotland, and we are in dire straits and we suffer the same problems, particularly about GPs. So can I ask the Minister if in the recent situation where we're seeing appointments disappearing, when we are going to see an improvement in appointments availabilities?
Well, I thank the Honourable Lady, and she will no doubt be extremely envious of the fact that in England there are 50 million more GP appointments now every year. That is a fantastic achievement by the government here, and she will want to look at what's happening in Scotland with some of the worst health outcomes in Western Europe, and she'll want to challenge SNP ministers over the levels of drug death rates, alcohol death rates and falls in life expectancy.
Sir Jacob Rees-Mogg.
Thank you, Mr Speaker. I wonder if my right honourable friend can explain an anomaly in the Agenda for Change pay deal as it affects non-NHS providers. That is to say, people working in the NHS for non-NHS providers may be eligible for extra money if the organisation they work for is in financial difficulties, but not if it isn't. So badly run organisations are being rewarded and well-run organisations are being penalised. This seems to me to be perverse.
I'm very happy to meet with my right honourable friend to discuss this matter. We have reached pay settlements with the Agenda for Change unions and continue to reach pay deals with other unions, but we are also supporting non-NHS providers whose contracts are dynamically aligned. It's a complex area, Mr Speaker, so I'm more than happy to meet with my right honourable friend to discuss his concerns.
Thank you, Mr Speaker. The Secretary of State will know that NHS England are expected to announce the primary children's centre cancer treatment for South London and South East London. Even in London, in my constituency, is one of the only specialist centres in South London. Does the Secretary of State agree with me that the final decision should be made as soon as possible to benefit staff, patients and families? And will she join me to visit Evelyn in London?
May I thank the Honourable Lady for her question. Indeed, in fairness, colleagues across the House have been raising this with me because, of course, it affects a very large population of London and surrounding areas. If I may, I must leave it to NHS England to finish their consultation process, but I would be very happy to visit not just the Evelina, but our other wonderful hospitals that look after children.
The expansion of health services through farmers. What action is my right honourable friend taking to ensure that communities like Sandiacre in my constituency, whose branch of Boots is due to close at the end of the month, are not left without access to such vital services?
Well, I'm very happy to meet and discuss this with my honourable friend, who is a huge advocate for her constituency. It's always very disappointing when a community pharmacy closes, but she will know that the launch of Pharmacy First on the 31st of January actually expands the value and contribution of all our community pharmacies, and it has been met with a £645 million investment over this year and next.
In terms of access to primary care provision, can the Secretary of State assure the House that she will liaise with health ministers in the devolved departments to ensure that rural communities do not lose out because of their isolated locations?
I'm very happy to give that assurance, and as I say, I was delighted to meet with Minister Swan yesterday to discuss his plans for Northern Irish healthcare, including access to primary care.
Obviously.
Can I remind members of my register in members' interests? The international recognition procedure by the MHRA will ensure faster access to innovative treatments, but it will only realise its full potential if matched by NICE's evaluation processes too. What is my honourable friend doing to ensure that the two processes are aligned?
Well, thank my honourable friend for raising this question. He will be aware that there have been delays with approvals by the MRHA and NICE. We are very keen to ensure that those delays come down. I'm very delighted to tell the House, Mr Speaker, that significant progress has been made in both organisations. I'm happy to work with my honourable friend and both organisations to ensure that the progress continues to be made.
Thank you, Mr Speaker. Figures obtained by the British Dental Association project that £8 million of the NHS budget in Somerset is going unspent. Can the Minister explain to my constituents who are suffering in dental agony why this is happening?
Well, I would encourage the Honourable Lady to hold her Integrated Care Board to account. We invest £3 billion, more than £3 billion a year in dentistry, and with our dental recovery plan, there is significant money available for NHS dentistry. It is for the Integrated Care Board to commission those units of dental activity, which in themselves now are offering more money, a minimum of £28 per UDA. And I'm very happy to meet with her if she's finding she's not getting anywhere with her.
Oh, thank you very much, Mr Speaker. I'm currently working with a brilliant local pharmacist, Fizz, to open a new NHS dental practice in Belfairs in my constituency. Premises and dentists have been lined up, but we need the ICB to commission the service. Will the Minister meet with me, my local ICB, and with Fizz to unlock this vital service as soon as possible?
Well, I'm delighted to hear about that. That's really good news for her constituency. I know she works tirelessly for them, and of course I'll be very happy to meet with her.
Richard Port.
Thank you, Mr Speaker. Wendy Hart had a high white blood cell count when she was discharged from the Royal Devon and Exeter. Her husband Terence described a dreadful, pointless 60-mile round trip home and back to hospital before Wendy died of sepsis. Will the Minister consider distances between acute hospitals and rural communities when reviewing hospital discharge guidance?
That's a good question. Very good question. Well, I'm very sorry to hear of what happened to his constituent, and my condolences with her family and loved ones. Clearly, it's very important that discharge decisions should be led by clinicians, and the clinical decision as to whether somebody is medically ready to discharge. And I have no doubt that the family may well be taking this decision up with the local NHS organisation.
Speaker, no doctor wants to be on strike, so I welcome the new deal with the consultant unions. Does my right honourable friend agree that this shows that by being reasonable, pragmatic and acting in good faith, unions can deliver for their members?
Well, may I thank my honourable friend who knows only too well the importance of industrial action and the impact it can have for patients and our impact on the NHS as a whole. I'm very pleased that today the BMA has announced that following the previous settlement that was very, very narrowly rejected in their ballot, they have been able to get back round the table with my officials and me, and we have been able to find a fair and reasonable settlement which they will very much advocate and recommend to their members. We hope that this shows those others who are choosing to strike that actually constructive negotiations, trying to sort out some of the concerns that we know clinicians have, these can be dealt with in a reasonable manner, which is to the benefit not just of staff but also of patients.
Final questions. Chris.
Thank you, Mr Speaker. Again, how many people were treated for acquired brain injury last year?
The honourable gentleman has caught me off guard. I will write to him. I am keen to continue working with him on this issue. As he knows, we've already shared draft details of the acquired brain injury strategy with himself and members of the APPG. I'm very keen to continue to work collaboratively on this issue with the honourable gentleman.
That completes questions. Thank you.
Order.